Long COVID, also known as post-acute sequelae of SARS-CoV-2 infection. PASC refers to a range of symptoms that persist for weeks or months after the initial COVID-19 infection has resolved. While many people recover from COVID-19 within a few weeks, some continue to experience health issues long after their acute illness. This condition can affect individuals of any age, including those who had mild or even asymptomatic cases. Common symptoms of long COVID. The symptoms of long COVID can vary widely and affect multiple body systems. Some of the most commonly reported symptoms include 1. Fatigue, extreme tiredness that doesn't improve with rest. One of the most prevalent and disabling symptoms. 2. Cognitive impairment, brain fog, difficulty thinking clearly, concentrating, or remembering things. Slowed cognitive processing or confusion. 3. Breathing problems, shortness of breath, especially with physical activity. Ongoing cough or chest tightness. 4. Cardiovascular symptoms, heart palpitations, feeling of rapid or irregular heartbeat, chest pain or discomfort. Elevated heart rate, tachycardia, particularly after minimal exertion. 5. Muscle and joint pain, persistent pain in muscles, joints, or chest. Weakness or reduced physical stamina. 6. Gastrointestinal issues, nausea, diarrhea, or abdominal pain. Loss of appetite or weight fluctuations. 7. Loss of taste or smell, altered or diminished sense of taste or smell, which can persist for months. 8. Sleep disturbances, insomnia or difficulty staying asleep. Vivid dreams or disrupted sleep patterns. 9. Mental health symptoms, anxiety, depression, or mood swings. Post-traumatic stress, especially in individuals who were hospitalized. Causes and risk factors. The exact cause of long COVID is still not fully understood, but some potential mechanisms include immune system overreaction. The body may continue to attack itself after the virus is gone, leading to ongoing inflammation and damage to organs. Organ damage. COVID-19 can cause lasting damage to the lungs, heart, kidneys, and brain, which can result in persistent symptoms. Viral persistence. In some cases, fragments of the virus might remain in the body, triggering an immune response. Autonomic nervous system dysfunction. Some people with long COVID develop postural orthostatic tachycardia syndrome (POTS), where the autonomic nervous system fails to regulate heart rate and blood pressure properly, leading to dizziness and palpitations. Risk factors for developing long COVID. Certain groups of people appear to be at higher risk of developing long COVID, including individuals with severe acute COVID-19 infections, e.g., those hospitalized or requiring intensive care. Women appear to be more affected than men, though the reasons for this are unclear. Older adults, especially those with pre-existing health conditions, are at greater risk. Individuals with comorbidities such as obesity, diabetes, heart disease, or asthma. People who were unvaccinated at the time of infection seem to be at higher risk of long COVID. However, long COVID can also affect people who had mild or asymptomatic infections, and it can occur in individuals of any age or health status. Organ systems affected. Long COVID can affect multiple organs and systems, leading to a broad range of symptoms. 1. Lungs. COVID-19 can cause lung scarring or inflammation, leading to prolonged breathing issues, even in individuals who never experienced severe respiratory distress during the initial infection. 2. Heart. Ongoing cardiovascular issues, such as myocarditis, inflammation of the heart muscle, or pericarditis, inflammation of the lining around the heart, can result in chest pain and palpitations. Some individuals may develop postural orthostatic tachycardia syndrome, POTS, causing their heart rate to spike upon standing. 3. Brain. Neurological issues such as memory loss, brain fog, difficulty concentrating, and even stroke-like symptoms have been observed in long COVID patients. Psychological impacts like anxiety, depression, and PTSD are also common, particularly in those who experienced severe illness or hospitalization. 4. Kidneys. In severe cases, kidney function may be impaired, leading to chronic kidney issues. Diagnosis of long COVID. There is no specific test for diagnosing long COVID, and diagnosis is often based on ruling out other conditions. Healthcare providers typically perform a variety of tests to evaluate symptoms and their potential causes, including blood tests to check for inflammation, organ function, and immune response markers, chest X-rays or CT scans to assess lung damage or ongoing inflammation, pulmonary function tests to measure breathing efficiency, cardiac tests such as an electrocardiogram, ECG, or echocardiogram to evaluate heart function, cognitive tests to assess the extent of brain fog or memory problems. Treatment and management. As there is no specific cure for long COVID, treatment focuses on symptom management and supportive care. The approach is often individualized based on the severity and nature of symptoms. 1. Rest and pacing. Pacing involves carefully managing physical and mental activity to avoid triggering post-exertional malaise, worsening of symptoms after exertion. Gradual increases in activity may be recommended, but only if the patient can't tolerate it without worsening symptoms. 2. Symptom-specific treatments. Fatigue, energy conservation techniques, physical therapy, and gradual activity increase. Breathing problems. Pulmonary rehabilitation, which includes breathing exercises and education on managing shortness of breath. Cognitive issues. Cognitive rehabilitation therapies, including memory exercises and mental health support. Cardiovascular symptoms. Medications to manage heart rate, blood pressure, and inflammation. 3. Mental health support. Psychological counseling or therapy to manage anxiety, depression, or PTSD. Medications may be prescribed to treat mood disorders. 4. Multidisciplinary care. Many individuals with long COVID benefit from care in post-COVID clinics, which provide access to specialists in fields such as pulmonology, cardiology, neurology, and mental health. Prevention. The best way to prevent long COVID is to avoid contracting COVID-19 in the first place. Vaccination has been shown to reduce the risk of severe COVID-19 and may also lower the risk of developing long COVID. Other preventive measures include wearing masks in crowded or high-risk areas, maintaining physical distancing and practicing good hygiene, getting vaccinated and boosted according to public health recommendations. Prognosis. The course of long COVID varies significantly between individuals. Some people recover within a few months, while others may experience symptoms for a year or more. Research is ongoing to better understand the condition and develop more targeted treatments. Early intervention and multidisciplinary care can improve outcomes for those affected. Conclusion. Long COVID is a complex and multi-system condition that can have lasting effects on those who have recovered from acute COVID-19. With its wide range of symptoms, the condition can be physically, mentally, and emotionally challenging. Ongoing research and tailored treatment approaches are key to helping patients manage their symptoms and improve their quality of life.